kuwe kureba.
Hey, bibiri. I don't know. Yeah, thank you so much. Hey.
Hello?
Abantu ntazi. Utekereza ko uri muri room yawe?
Good morning, ladies and gentlemen. Good morning. My name is Grace Ilizandatinya, and I am a lecturer in the Department of Community Health and Social Medicine at the University of Global Health Equity. I am so happy, so delighted to welcome you to a unique session. Believe me, you've not seen anything like it before. I would like you to really sit at the edge of your seat because what we are going to be doing today, I will be taking you on a journey with me to really experience social medicine in medical education. Now, recently I had a conversation with a leader that I highly esteem, and I will quote. I think when I say my quote, you might know who I'm talking about. So this person said that social medicine is the reason why late Dr. Paul Farmer and PIH founded the University of Global Health Equity, that social medicine is the thing that will disrupt order, and that social medicine is the thing that will bring transformation in medical education and practice. Now, I don't know if you believe this, but I couldn't agree more. So right now, without further ado, I will invite you on a journey with me, as I was saying, that will demonstrate how us at the University of Global Health Equity have taken this on to teach social medicine through community-based education to our medical students. I would like to highlight that all the people that you will see throughout the session are not actors. They are all doing what they do in their role. So if this is a student, they are really a student at UGHE. So without further ado, we're going to start now.
Hello, hello. We are now arrived in the community. Thank you, our drive. I did great.
You're welcome.
Thank you so much. I told you in social medicine, everyone is important, right?
Yes.
Everyone is important. Before we head to the community workers' home, I want you to remind me the objectives of today.
Thank you very much. So the objectives of today is in Canvas. We are going to experience the patient journey in our community, and we are also going to actually look at the community health worker role in the community, especially when it comes to maternal and child health.
Perfect, amazing. Any other who may complete you?
So the previous time we went for the ANC visit 1, and today we are going for the second visit.
Amazing. Let's head to the community health workers. It's not far from here. It's around 10 minutes. Let's go.
Okay.
But it's down there.
What you're seeing here
How far is it? I think we've been working
is
for
a
like
team of UGHE
15
medical
minutes.
students.
Yeah, guys,
with
this
their
is a patient
faculty,
journey. This is a patient journey.
and
Yeah.
they're heading towards the community health workers.
Oh, we are almost there. Jean, muri murugo?
Yego.
Uraho?
Muraho neza.
Amakuru.
Murakomeye.
Nongeye nakuzaniye ba banyeshuri bawe b'abantu ukunda.
Yego ni byiza cyane ndabyishimiye uraho.
muraho.
Muraho neza.
Muraho.
Murakomeye.
Uyu munsi nazanye n'abandi barimu bagenzi banjye.
Yego ni byiza cyane. Muraho. Murakomeye.
Reka rero tukwibwire maze kugira ngo dukorane tuziranye. Aba ariko abanyeshuri ntabwo ari ubwa mbere baje bongeye kuza, ubu ni ubwa kabiri. Uretse ko hari bagenzi bacu bashya ariko nabo ntiwabibuka wakira benshi.
Ndi kugenda ndabamenya ndi kubareba.
Njyewe nitwa Deni Ndangurura, ndi umwarimu kuri kaminuza i Butaro, nkakurikirana ibikorwa byo kwigira muri community mu mudugudu wacu.
Yego urakoze.
Nanjye nitwa Rano Tuyizere, nkaba ndi umunyeshuri wa gatanu ubuganga, nkaba nishimiye kuzana no munsi.
Yego murakoze.
Jean, waramutse neza?
Mwaramutse.
Urakoze. Nanjye nitwa Aimable Uwimana, ndi umwarimu muri kaminuza, nkabashinzwe n'ibijyanye n'imikoranire ya kaminuza n'abaturanyi bacu.
Yego murakoze.
Jean turaziranye, nitwa Akiki, ndi umuganga kandi ndi umwarimu muri kaminuza.
Murakoze cyane. Nanone nitwa Himbazwa Benite, ndi mwaka wa gatanu muri kaminuza ari i Butaro. Murakoze kongera kutwakira.
Yego namwe murakoze.
Murakoze cyane. Nanjye nitwa Teta Chanciela, nigana na Benite mu mwaka wa gatanu.
Yego murakoze.
Murakoze Jean, nitwa Phil Cotton, umuyobozi wa kaminuza.
mwakoze cyane kutwakira nanjye nitwa Ishimwe Soleil nanjye nigana n'abandi banyeshuri mwakoze.
Mwakoze cyane nanjye nitwa Sandra Isano ndi umwarimu muri kaminuza. Mwakoze.
Nanjye rero nitwa Mukarurangwa Jeanne ndi umujyanama w'ubuzima ndi n'umwarimu wa kaminuza mu mudugudu hano ni iwanjye ni karibu nta kibazo mwakoze cyane.
What you're seeing here is Jeanne, a community health worker and a community faculty for UGHE, receiving medical students and their faculty in their home, and they have just finished an introduction round where she introduced herself and the students and faculty did the same.
Nkuko nababwiye rero ko ndi umwarimu wa kaminuza uyu munsi tugiye kwigana isomo ry'uyu munsi ryitwa gusura umugore utwite inshuro ya kabiri. Intego y'isomo yitwa gushishikariza umugore kujya kubyarira kwa muganga. Hanyuma rero umugore wacu tumukorera amasura 3. Isura rya mbere turikora tukimara kumenya ko yasamye inda iri munsi y'amezi 3. Isura rya gatatu tukarikora hagati y'amezi 5 na 6. Isura rya gatatu tukarikora hagati y'amezi 8 n'9 ubundi ku mezi 9 umubyeyi wacu akabyara. Ariko hagati aho ntabwo dupfa kugenda nta bikoresho dufite.
Jeanne introduces the session by telling the student what the lesson today is going to be about, which is entitled Antenatal Care Visits at the Community Level. She explains that today they are going to be visiting a pregnant woman in her village at the 2nd visit. She talks about these visits, saying that she does 3 visits for every pregnant woman in her village, spaced between the first is within the first 3 months of pregnancy, the second is between the 5th and the 6th month, and the 3rd visit will be between the 8th and the 9th month towards the delivery of the baby. So today they are going to be doing the 2nd visit with a group of students and faculty, and she also highlights that when she goes to do her visit, she doesn't just go, but she has a set of tools which she's excited to show to her team.
Ibikoresho dukoresha rero tugiye gusura umubyeyi ntabwo dupfa kugenda gusa. Amakuru ntabwo twapfa kuvuga mu kirere ahubwo dufite ibitabo twandikamo. Iki ni igitabo cya mbere ni ikarita umujyanama yifashisha ari gusura umubyeyi bakagirana ibiganiro. Igitabo cya kabiri ni ifishi yandikwamo umugore utwite n'amakuru aba yaduhaye. Ifishi ya gatatu ni transferi umujyanama atwara kugira ngo nasanga umubyeyi wacu afite ikimenyetso mpuruza amuhe transferi amwohereze ku kigo nderabuzima. Ikindi gitabo umujyanama yitwaza ni igitabo cyandikwamo abagore n'abakobwa bari mu kigero cyo gusama kuva ku myaka 15 kugeza kuri 49. Ikindi gitabo ni igitabo cya rapid SMS. Amakuru yose tuyandika mu gitabo cya rapid SMS tugatanga na rapid SMS ubutumwa kuri Minisiteri y'Ubuzima. Umubyeyi wacu akamenya niba Minisiteri ikamenya niba umubyeyi wacu afite ubuzima bwiza cyangwa se niba hari ikibazo yagize. Ikindi gikoresho dukoresha ni miwake, tuyikoresha turi gupima umuzenguruko w'ikizigira, turi gupima imirire y'umubyeyi. Ikindi gikoresho dukoresha ni igipimo cy'ubushyuhe.
Jeanne proceeds to show these tools to the students, and she says, and I quote, "We do not just go empty-handed to visit our mother, but we go prepared and equipped." She starts by showing them a teaching guide that has images that help her when she's engaging in her sessions with the mother. She shows also different books and documents that she uses to record information about the household. She also shows them what is called a rapid SMS book, where she records information that she's going to be sending, showing that she made a visit. So she also proceeds to show them tools that she uses for her measurements, to screen for nutrition for the mother, and also to check the temperature of the mother.
Maze kubereka ibikoresho dukoresha aka kanya tugiye gusura umugore wacu yasura nababwiye rya kabiri. Mutega amatwi ariko niba hari waba afite ikibazo mbere y'uko tujya gusura umuryango yambwira.
Murakoze cyane, ibikoresho twabifashe, murakoze kubitwereka. Twashaka kongera kubabaza nitugera mu muryango ni kimwe mwifuza ko twakwitwararika cyangwa se ni iki mujya mwitwararika iyo mugiye kubasura?
Nitugera mu muryango ikinyapfura cyo ndabizi muragisanganywe, abari mu banyu baba barakibahaye. Rero iyo tugeze mu muryango uko tubasanze niko natwe twisanisha nabo, bakatwibonamo natwe tukabibonamo, tukabasha kuganira twese twaciye bugufi k'umurongo.
Jeanne invites the students to ask any question that they may have before they proceed to do the visit. And Benit, one of the medical students, asks if there is anything that Jeanne thinks they should keep in mind as they go to visit this family. And Jeanne says, I trust you as medical students from UGHE that you are very well disciplined, but one thing I would like to add is that we have to have humility, and when we go to approach this family, we have to build rapport and be able to be at the level where we can have good communication with them. So she really highlights the aspect of humility because it is important in building trust.
Murakoze cyane rero tugiye ku muvyeyi uri buze kugira ikibazo ari buze kukimbaza tuvuyeyo.
Now the group of students led by Jeanne are now heading to the family they will visit. Now this is usually a hike in the hills of Butaro, so you'll consider that we are moving
nta kibazo ariko imisozi turayimenyeye kandi baratworohereje imidugudu bayishize ku murongo ntago tukiri kwa kundi kugenda umuntu arashaka.
Batisi ni kubona abashitsi bo twadutegereje baje.
Kadara ndi gushaka twatse twimwe.
Yego. Amakuru yanyu.
Ni meza.
Ni karibu se.
Ni karibu.
Muraho.
Yego.
Muraho.
Yego mujyanama. Yego. Muraho.
Muraho.
Yego. Muraho.
Papa muraho.
Yego yego. Yego.
Ni karibu se Jacqueline.
Yego. Yego.
Ni karibu.
Ni karibu.
Ariko muratubabarira kubera hari ubukene bwinshi ntabwo twabashije kubona udutebe hari muradufasha twicare.
Oya wigira ikibazo.
The team has now arrived and the family receives them, but the mother apologizes, saying that, oh, you're going to forgive us, we do not have enough chairs for you. So the team proceeds to sit down.
Ni byiza cyane.
Uyu munsi rero nifuje kubasura ndi kumwe n'abashyitsi. Nkuko nabibabwiye nababwiye ko uyu munsi nzaza kubasura ndi n'abashyitsi. Ngaba nabazanye n'abashyitsi bavuye kuri kaminuza hariya hakurya. Nimugire ikibazo rero n'abashyitsi biga ishami ry'ubuganga. Nabo muri iyi minsi aba ari abaganga barajya baradukoraho.
Mujyana nuko rwose.
Rero kugira ngo tuze gukorana tuziranye reka banze nimbibwire. Yewe musanzwe muzi undi kwa Mukarurangwa Jeanne abandi umujyanama w'ubuzima abandi umwarimu wa kaminuza. Aba banyeshuri rero bazanye n'abarimu babo reka nabo babibwire nibamara kubibwira namwe murabibwira twigana ikiganiro cyacu tuziranye.
Byiza.
The community health worker, Jeanne, introduces the group of students, saying, today I did not come alone as I usually come. I came with visitors, as you can see. And she explains to the couple that these are medical students who are going to be future doctors tomorrow. And they came to learn from them. And now they're going to proceed to introductions.
Nongeye kubasuhuza. Nishimiye kuba aha ngaha. Amazina yanjye ni Teta Chanciela, nanjye ndi umunyeshuri muri kaminuza Jeanne yigishamo, niga mu mwaka wa 5.
Murakoze cyane kutwakira. Nitwa Himbazwa Benite, nigana na Teta mu wa 5. Jeanne nawe ni mwarimu wacu.
Mwakoze cyane kutwakira, nitwa Ishimwe Soleil, nanjye nigana n'abagenzi banjye Jeanne n'umwarimu wacu.
Nitwa Phil Cotton, umuganga, umuyobozi wa kaminuza.
murakoze kutwakira nanjye nitwa Rono Tuyizere nkaba ndi umunyeshuri w'ubuganga mu wa gatanu turigana.
Murakoze cyane kutwakira nanjye nitwa Sandra Isano nkaba ndi umwarimu muri kaminuza. Murakoze.
Muri aho nitwa Akiki nanjye ndi umuyobozi kandi umwarimu muri kaminuza kandi ndi umuganga. Murakoze kutwakira.
Murakoze, nishimiye kuba turi kumwe namwe. Nitwa Deni Ndangurura, ndi umwarimu kuri kaminuza i Butaro. Uyu munsi rero turishimye kuba mutwakiriye tuje kwigira hamwe namwe.
Murakoze cyane. Nanjye nitwa Aimable Uwimana, abandi umwarimu muri kaminuza kandi nshinzwe n'imikoranire ya kaminuza n'abaturanyi bacu. Sinzi amunyibuka cyagezeho ni umuganda turi kumwe.
Mujyana urakoze utuzane n'umuyobozi wa kaminuza. Byiza cyane. Ni umugisha. Nanjye rero nitwa Jean Baptiste Ngarukiye Intwari, ndi chef w'uyu mudamu.
Nanjye nitwa Musabyimana Jacqueline, mujyanama twishimiye ko batuzaniye abashitsi, ko batuzaniye n'umuyobozi wabo.
The family expresses great delight. They say we are very happy to welcome you, and they are very surprised that even the leader of the university came to visit us. We are very happy. And Jean-Baptiste introduces himself and says that he is the chef of the family.
Murakoze cyane, tumaze kwibwirana turaziranye. Jacqueline rero tugiye kuganira kwa kundi kuganira iyo naje kugusura. Ubwo mperutse ahangaha kugusura isura rya mbere, mwaba mwibuka ibyo twaganiriye uwo munsi?
Isura rya mbere ibyo naba nibuka, wadushishikarije kujya kwa muganga, dushishikariza no kurya indyo yuzuye.
Yego.
Ariko ku ndyo yuzuye hari bimwe tubona ibindi ntitubibone bitewe n'ubushobozi bukeya.
Nta bindi waba wibuka se?
Mwunganiye wanarwigishije ibimenyetso mpuruza ku mubyeyi utwite, harimo kweruka mu maso, kubabara mu mutwe cyane bikabije, kuvira ku nda no kumeneka isuha igihe cyo kubyara kitaragera.
Yego. Murakoze cyane, ndumva mukibyibuka. Ariko se Jacqueline, twa tunini twa feri kurara mu nzitiramibu mubikoranye umutwe wabyibagiwe. Ibyo byose utunini uradufata urara mu nzitiramibu?
Tunini baratumpaye ndaturya n'inzitiramibu barayimaye ntiryamamo nta kibazo.
At the beginning of her session, Jeanne wants to refresh the memory of the couple about the information that they discussed during the first antenatal care visit. And both Jean-Baptiste and Jacqueline take turn in talking about the information that they remember. They talk about the importance for good nutrition, but Jacqueline mentions that it has been challenging to find all the foods that they have talked about. And Jean-Baptiste proceeds to talk about the danger signs of pregnancy, some that he remembers, like premature rupture of membrane, like bleeding during pregnancy, like fever. And Jeanne is very happy that they remember the information. She also asks to the mother if she was able to take her iron supplements and also sleeping under the mosquito net because it is very important to prevent malaria.
Jacqueline, rero ndi kumva ibyo twaganiye ku isura rya mbere ukibyibuka kandi urabyubahiriza kuva urya indyo yuzuye nubwo biba bitaboroheye ariko mukomerezaho. Uyu munsi rero tugiye kwigana isura rya kabiri nkuko nabikubwiye. Tugiye kongera dukoreshe iyi karita yacu tureba amashusho. N'ubundi igitabo ngiki ndi kugira ngo umbwire icyo uri.
Ndabona umugabo uri n'umudamu we. Iyi shusho ya kabiri ndi kubonaho inzu ishushanyijeho agasaraba. Iya gatatu ndi kubona hariho amafaranga. Iya kane ni ikigoma y'umwana.
ko buriya ntawe wambwira 5 niba wakurikiye.
hariho ibitenge by'umudamu.
Yego urakoze cyane. Hanyuma rero aya mashusho yacu icyo avuga, umugabo n'umugore ntabwo bakwiye kujya ntabwo umugore akwiye kujya kwa muganga wenyine, umugabo agomba kumuherekeza cyangwa se agashaka n'undi muntu wo mu muryango akamufasha. Amafaranga nayo kudufasha kugira ngo tubashe kugura ibi bikoresho ari byo ibigoma by'umwana, ari byo ibitenge umubyeyi azambara akimara kubyara, ukubyumva. Aya mafaranga rero ni byiza ko mwayazigama mukayifashisha kugira ngo azanabafashe igihe muzaba mugiye kwa muganga n'igihe muzaba mumaze kubyara. Ishusho ikurikiyeho
iriho umudamu n'umugore bari gukusanya ibikoresho.
Andi mashusho 3 akurikiyeho
niyo umudamu bahetse mu ngobyi n'agasahani kariho ibiryo n'agakombe n'umwana n'umumama bari gufura.
Yego rero icyo amashusho atubwira ahangaha, ni byiza ko umubyeyi akwiye gutegura indyo yuzuye ibyo kurya azabyara ari ku bitaro se, cyangwa ibyo kurya azarya ari ku bitaro se, cyangwa ibyo azarya akimara kubyara. Agashaka n'igikoma hakiri kare. Umubyeyi ni byiza ko akeneraga igikoma. Hanyuma ahandi rero uyu mugore uri mu ngobyi, umugore afite amahirwe menshi yo kubyarira mu nzira, kandi twabonye ko mu nzira kubyarira mu nzira ari kirazira, yahura n'ibibazo byinshi. Uyu mugore rero bishushanya ko umugore ubundi akwiye kujya kubyarira kwa muganga. Ishusho ikurikiyeho rero, mugomba gushaka umuntu uzasigara ku rugo akita ku bana, akita no kuri ya matungo kugira ngo bazabashe kubunganira. Ntari byiza kugira ngo abana bazasiba ishuri ngo nuko mwagiye kwa muganga. Muri kubyumva? None nta kibazo mufite kuri bitumaze kuganira ngo mumbaze.
So Jeanne uses her guide, which has images that are that the couple is reading and saying what they're seeing. On the card, we see an image where there is a house and there is a red cross, and that image is demonstrating or encouraging the mother to not deliver at home, that it is prohibited to deliver at home, but she should always deliver from the health facility. There are also other aspects of the message, such as financial preparedness, making sure that they prepare for the clothes that the baby is going to be wearing, since Butaru is a cold area, and also making sure that the mother has prepared someone to stay at home to fulfill the home responsibilities and not have the other children at home skipping school. She also talks about making sure that they have some money put aside so that they can organize for the transport of the mother to the health center.
Ikibazo cyo nakubaza, ikibazo cyo kuri indyo yuzuye watwigishije ko twaza turabona imboga, ibijumba, ariko muri ibyo ngibyo icyo mbona ni ibijumba, imboga, uturayi, wenda ntabwo bikabije ko nabura udufaranga two kuba nagura utwo dukoresho, ariko ibikomoka ku matungo ntabyo mbona bitewe n'ubushobozi bukeya.
Buriya rero ibikomoka ku matungo ntari ngombwa inyama. Kiro cy'inyama kirahenda, urabizi ko ku isoko kikugura 5, ariko indagara duturiye kira kiyaga cya Burera, indagara ziraza wabona ni za 300. None indagara za 300 urumva byaba bigoranye shefu w'urugo?
Yazaboneka. Zaboneka, tuzaturagerageza indagara ziboneke mu gihe hatabonetse ibindi bikomoka ku matungo.
Yego.
Jacqueline expresses a concern, saying that during the last visit we talked about a balanced diet, we talked about how we should get all the food groups, but it is a challenge to get, for instance, animal products, to get meat. It is very expensive and we're not able to get it. And Jeanne responds by saying, you know, even if you don't have meat, because I know that it is expensive, 1 kilogram is 5,000 Rwandan francs, you can't always get it, but at least you can have the small fish. You know, we are close to the lake, you can find small fish, which is not expensive. And Jean-Baptiste says that he can find that.
ikibazo mwabaza uyu muryango mbere y'uko tubasezeraho tugataha.
Normally, Jeanne would go about another half an hour to continue her visit and taking measurements for the mother and continuing to have conversations with them. But for the purpose of this plenary, we are going to shorten the session here and we're going to invite the students to ask any question that they may have to the family.
murakoze cyane ko mwatwakiriye Jacqueline na Jean Baptiste twishimiye kugera hano rero nkuko twaje kubigiraho nifuzaga kubabaza mubona ari akahe kamaro bibagirira kuba umujyanama w'ubuzima zo kubasura ni akahe kamaro by'umwihariko bigira ku buzima bwanyu nk'umugore utwite ndetse no ku mwana muba muzabyara.
Benit is curious to hear from Jacqueline. How does she feel when a community health worker comes to visit her? What is the importance of these visits for her?
umujyanama w'ubuzima tugira inama akadushishikariza kujya kwipimisha mbese muri njyewe numva ari ishema ryumva mfite kubona umujyanama yaza kungira inama mbese nibyo bintu bimpesha ishimwe kandi nawe mu mudugudu inzego zamushizeho turazishimira.
Jacqueline says that when she sees Jeanne visiting her, she really gains a lot of insights from her advice, and this has been very useful and helpful to her, and she says that she feels very proud that Jeanne visits her, and she thanks the authorities who have put Jeanne in place and given her the responsibilities that she does.
mwakoze cyane nayo nari mfite ikibazo mwakoze kutwigisha byari byiza cyane njye noneho ikibazo nari mfite yego wenda muradufasha nyine natwe mudusangize ese kuki mwumva ari ngombwa ko abanyeshuri nkatwe biga ubuganga cyangwa biga ibindi baza kwigira mu rugo noneho muri community.
murakoze icyo bidufasha nk'abanyeshuri muri kwimenyereza kwiga ubuganga mukamanuka mukaza kudusura mu giturage wacu icyambere mubona uko tuba tubayeho mumenye ubuzima bwacu mukamenya uko muzabasha kudukurikirana ariko cyane cyane mwamanjije kumenya ese mu giturage bari abantu babayeho bate ni gute tuzabafasha igihe tuzaba twashoje amashuri twabaye abaganga.
Soleil asks, in your opinion, why do you think medical students like us should come to visit you or to have home visits like this one? What do you think is the importance? Jean-Baptiste says that he believes that the reason why it is important is that it allows the students to observe and to learn and to understand the context in which they live, to understand their daily life, their condition, which will make them better doctors because they will be able to treat them from an understanding of their context.
murakoze cyane rero kuba mwatwakiriye ni byiza cyane mwakoze nanjye ndishimye n'abanyeshuri mwumvishe ko babashimiye mwakoze cyane Jacqueline komeze tuyitaho.
Yego
natwe turabashimiye rwose
mwakoze cyane mwakoze.
yego
mwakoze urugendo rwiza rwo gutwita bizagenda neza.
yego namwe mwakoze kudusura. yego
Now, the group of students and faculty have completed the visit and they are going back to Jeanne's house for a reflection session.
murakoze rero urakoze cyane uratwigishije ariko abanyeshuri bashobora kuba bafite ibibazo batasobanukiwe uyu ni wa mwanya twita umwanya wa mwarimu ubu rero noneho ugiye kwisanzura n'abanyeshuri nabonaga bashaka kubaza ibibazo kugira ngo babaze ibibazo byose bagize twemere rero duhe uyu mwanya kugira ngo niwo mwanya wo kugira ngo bige neza baze kumenya ibyo batasobanukiwe umwanya ni uwawe.
yego mbanje kubashimira mwitwaye neza ku mubyeyi wawe.
Thank you so much. You have been amazing.
none se uyu munsi hagati y'umujyanama n'ababyeyi uriya muryango twagiye gusura mwabonye byifashe gute, ni iki mutari muzi, ni iki cyahindutse muri mwebwe? hagire abantu babiri bambwira.
I would like two of you, the students, to tell me how did you find the visits, what appealed to you the most, is there something that surprised you, how did you find the visit?
Murakoze cyane, ngiye byanshimishije cyane. Icyantunguye ni uburyo urabona nka kuri yatubwiye ngo muratubwira ngo turye indyo yuzuye, ariko nk'inyama ntago tubasha kubibona. Kandi mu by'ukuri koko niko bimeze. Iyo waje kwa muganga turababwira ati mugende mushake ikiro cy'inyama, mushake inyama nyine arizo mujya murya, kandi mushake n'ibindi biryo nk'uko twababwiye twabibasobanuriye. Ariko numvisha uburyo mbashije kumva uburyo abaturage nyine cyangwa se navuga abamama batwite ibibazo bahura nabyo, cyane cyane nk'uko atubwiye ati ntabwo nabasha kuyibona. Rero mbashije kubyumva nanjye bizajya bituma abarwayi nzajya mbasha kumva aho baturuka, bikaba byatuma nanabafasha.
Ikibazo cya kabiri.
Chancellor says that she learned something very important about the conversation that Jeanne had with the mother, because she expressed the concern of not being able to afford certain foods. Chancellor remembers that sometimes when patients come in the consultation room, they educate them about nutrition, they tell them about the food they should have, they should buy, they tell them about the meat and about the milk. But today, because she made this visit, she was able to understand that sometimes it is not an issue of them not knowing, but an issue of not having this available to them. So this has really opened her eyes to better understand.
Ikibazo cya kabiri ko cyari ngombwa ko umujyanama asura umubyeyi inshuro 3.
Jeanne wants to know from the students, why is it important for the community health worker to visit a pregnant woman 3 times during her pregnancy?
Yego murakoze cyane, nkuko mwagiye witwigisha umujyanama asura umubyeyi inshuro 3, kubera ko kuri buri nshuro haba hari ikintu ari bumwigishe atarasanzwe azi. Wenda tuvuge nk'uyu munsi icyo twize, yego nk'uyu munsi twabonye ko mwamweretse amashusho, mukabanza hakabaho kwibukiranya ibimenyetso mpuruza, hanyuma n'ubushize bwe twabibonye mwari mwabikoze. Ariko uyu munsi hari ibintu bishya mwamwigishije, mwamubwiye yuko umugore tugomba kujya kwa muganga wenyine, agomba kujyana n'umugabo cyangwa se yaba adahari akagira undi muntu umuherekeza. Bagomba gutegura amafaranga bazifashisha bajyayo, bagategura imyenda y'umwana, imyenda y'umubyeyi bazakoresha, bakagira indyo yuzuye, ariko bakanibuka kuzagira umuntu usigara ku rugo kugira ngo n'abana bazajye ku ishuri ntihagire ikintu gihungabana. Kandi iri sura rikorwa turi gushishikariza umubyeyi kuzajya kubyarira kwa muganga, kandi rikaba hagati y'amezi 5 na 6. Murakoze.
Yego murakoze cyane mwakurikiye. Aka kanya rero abanyeshuri babiri nanjye mugira ikibazo mwambaza. Nta kibazo mwagize?
Benita explains that the reason why the community health worker has to do these 3 visits is because she observed that there was new information at every visit that she provides to the mother. She gave an example that the first visit mainly consisted of understanding the danger signs in pregnancy, but today there are other points that were covered, such as preparedness for delivery, such as going as a couple to deliver at the health facility, and other components that were new at this visit. Now Jeanne invites the students to ask her any questions they may have.
Murakoze cyane. Ikibazo mfite, ese mubasha gufatanya gute akazi mukora n'izindi nshingano muba mufite na kano kazi k'ubujyanama b'ubuzima?
Yego, umurimo wacu dukora buri munsi ni ubuhinzi, ariko abagore tuba dufite mu mudugudu ntago baba bari mu masura. Niba wenda ari abagore 5, ntago bose baba bari mu masura icyarimwe. Hariho uburi ku isura rya mbere, undi ari ku isura rya 3, akazagira amezi 5 na 6 ku kundi kwezi hakazaba hariho uw'8 n'9, bikatworohera. Ntago bose tubasura. Niba ari abagore 5 ntago tubasura mu kwezi kumwe uko ari 5, baba bari mu byiciro kuko baba batarasamiye rimwe.
So Chancela is curious to know how does she balance her responsibilities as a community health worker going to perform her home visits and her responsibilities as a mother and for her household. And she explains that these visits are spaced out during the pregnancy of the women, which means that she doesn't visit all the women at the same time because they do not conceive at the same time, which means that in a month she will have a limited number of women to visit.
Akoze twishimiye uburyo twasanze ababyeyi babakira n'uburyo tuba tubona mwishimanye mumenyeranye twebwe nk'abanyeshuri natwe biratwigisha kugira natwe tuzabashe kuganira n'abarwayi nka kuriya batwisangemo kuriya. Ikintu rero dukunda kwibaza nk'abanyeshuri niki kibatera imbaraga zo komeza gukora no murimo kuko ari umurimo utoroshye kandi nta mukora nk'abakoranabushake mutawuhemberwa. Ubwo niki gikomeza kubatera imbaraga zo komeza kubikora. Murakoze.
Arnold has a question to Jeanne. He says that he really appreciated the affinity that he saw with Jeanne and the family and how they welcomed her and how they had a very good familiarity. But this raised a question to him and other students as to what is the motivation for Jeanne to be doing this work despite the fact that she does not get paid for this work.
Urakoze cyane nkanjye nk'umumama w'umubyeyi w'umugore ikintera ishema mbyara mu ibyara ryanjye ngiye nahuraga n'ibibazo ntago najyaga kubyarira kwa muganga. Muri ibyo bibazo rero nahuriyemo nabyo nifuza ko umubyeyi nkanjye mugenzi wanjye aho leta cyangwa se abaturage bangiriye icyizere bakantura bakangira umujyanama w'ubuzima nanjye numva nabagaragariza icyo cyizere nkafatanya nabo mu buzima ku buryo nta mubyeyi w'umugore wo mu mudugudu wanjye nakumva ko yagira ikibazo nk'icyo nahuye nacyo iyo tugiye kwa muganga akabyara umwana muzima tukaza dufite umwana muzima mu biganza n'umubyeyi wacu ari muzima bintera ishema. Numva ari ibintu by'agaciro bikantera ishema nubwo tudahembwa ariko umuturanyi wawe yafite ubuzima buzima nawe ufite ubuzima buzima.
Jeanne explains that back in the day she experienced complications during pregnancy because she did not have access to a healthcare facility or deliver at a healthcare center, at a health center. So today when she sees that her neighbors, that her community has trusted her to support the pregnant women on their journey, it really fills her with pride to see that she's able to contribute to their life, to their well-being, and make sure that no woman faces the same complications or difficulties that herself she faced. She also says that it makes her very proud. Despite the fact that they're not paid, this is a big motivation to her when she sees that her neighbors are in good health, when she accompanies a woman to deliver to the facility and they bring out a healthy baby. That makes her happy.
Murakoze cyane ja. Rero urakoze cyane watwigishije neza abanyeshuri nizere ko ari ikintu mutahanye amatsiko mugabo mufite muri kaminuza y'imikorere y'abajyanama b'ubuzima uruhare rwabo murabisobanukiwe n'ibindi byose mutaba mwasobanukiwe muragumya muzabyandika muri raporo yanyu tuzabiganira na Jeanne. Rero nagira ngo umwe muri mwe ashimire Jeanne cyane kubera kuko iyi ni isomo tudashobora kubonera muri kaminuza tutageze mu rugo rw'umujyanama w'ubuzima cyangwa ku mubyeyi. Nagira ngo umwe muri mwe rero ashimire umujyanama Soleil.
Dennis invites the students to say a word of thanks to Jeanne, and he hopes that this visit was educational, and in case they still have other pending questions, they will be forwarded to Jeanne and she can answer them later. Soleil wants to give the message.
Yego, Jean wakoze cyane ni ukuri twakwigiyeho ibintu byinshi cyane uretse no kuba watwigishije twishimiye n'ukuntu uba wita ku babyeyi ukabakurikirana ubuzima bwabo busanzwe ni ibintu twize natwe tuzakomerezaho gukora nk'abanyeshuri kuko urabona turi kwiga turi kwegereza kuba abaganga natwe tukwijeje ko tuzabikurikiza kandi tukabyigiraho byinshi. Ikindi wakoze kutwakira ukaduha ikaze ndetse n'ubutaha turabizi ko tuzagaruka ukatwigisha.
Soleil thanks Jeanne, saying that what they learned today is very valuable and important on their journey to become good medical doctors, and she really appreciates how well she welcomed them and received them and hopes that they will see each other next time.
murakoze cyane rero Jeanne, urazi hano imvura igiye kugwa, turabona ikirere kimeze nabi, ariko ibi ngibi byigisha abanyeshuri urugendo rw'umubyeyi anyuramo agiye kwa muganga. Ntugire ngo rero dufite ikibazo, n'ubundi tuzagaruka nta kibazo.
yego murakoze cyane.
Thank you very much. I hope you enjoyed this as much as we did. And as I was saying before the play...
Thank you. Time is flying.
Thank you very much. As I was saying before the play, this is not a role play, because Jeanne is indeed a community health worker, and her and the couple that we have today came all the way from Butaro so that we can have this today. So please, a round of applause.
Hey.
Now we are going to have a small discussion. I am sure that there are things that you observed. I'm sure that there are things that you heard. In fact, this was in Kinyarwanda, but I hope that as we tell our students, a lot of the learning happens in the observation. There are things that people will not tell you, but you're able to see by being observant and listening. So right now, I would like to invite on stage Dr. Ferne Leange. He is an amazing global health leader in social medicine who has really walked the talk of social medicine, and I know we will be happy to hear from you. Dr. Ferne.
Thank you. Moao. Oh, you don't know the answer here? Okay. What you just saw, it's about some concept that we teach in social medicines in practice. And I will summarize some of those concepts. We could have some slides, but the most importantly, the first one was about the shared mastery, where we bring students to the field to observe and to learn from the community health workers. And this concept is important because it is not only accompaniment, it is humility. So those are the domains, but we are not going to focus on this slide. But quickly, because we have to give you space to discuss what you have seen, those are part of the domains that we have identified, but they are not the only one. It is not an exhaustive list. So what we have seen, we try to re-socialize in care, which is important. We talk about this in the humanity sessions a lot. And I think most of you have attended the humanity sessions. Why it is important? The contact with the people we are serving. So the first concept that you have seen here, the shared mastery, the humility, and the accompaniment are really important way for our students. We are talking about medical education and competency-based education, competency-based curriculum. So we want people to learn not only from the community health workers. This is only one topic. It was maternal health. It was not even maternal health globally, but it was focused on pregnancy. But we also have home visit tailored to NCDs. Any burden of disease, you could tailor those for the student. And all of those faculty, the community health workers are part of the faculty, because this is in contact with the community health workers that people could learn. And also the community members. We take time to bring regularly, and we learned this from early days. I learned this from early days with Paul. Even you see people, you see patients at the office, at the clinic, but at the end of the weekend, you will work sometimes 6, 7 hours to visit people at home. which is important in the resocializing care domain we are talking about. And we see the practice of shared mastery because people have their own experience. We want to listen, we want to learn, we want our students to share this learning in practice. And humility, as you know, you could learn from anyone just by listening. Their experience, their journey. You see the journey of the community health workers, but also the journey of the patient. And one of the concepts we have seen all of those social determinants at play here. We hear about food, lack of food. We hear about transportation. We hear about education. So all of those, there's in practice way, people could learn those social determinants to understand the relationship between social determinants and human rights, also the impact of those social determinants on the bad or good outcomes. So the other concept, before I say it, I pass to you for your comment, the person-centered care. It is one. Jan said this is one patient. And the focus was on this patient, the household, and his joy, his difficulty in life. All this is, we start with patient-centered care. Now we move it to person. The person behind the patient. If it was a diabetic patient, if it was a mental health patient, we need to understand all the factors, all the determinants at play. When we talk about person-centered, it is the person behind this patient. His joy, his neighborhood, the relationship, his journey. So it is really important. And this is how we operationalize equity, because at some point you touch where it is really important, the burden of disease for people most in need. I will stop there, but this is an example of the TB patient-centered care, all of those interventions that you could understand for the scholars who are here. So why our intervention are multi-aspect on the life of the patient. It will be, for this TB patient, it will be DOT, drug observed therapy, by the community health workers. At the beginning, it was every day. No one in the consultation room could do that. Only the community health workers living in proximity will be there for the patient. And we see transportation. This is why we said in the social medicines, you are going to touch all of the sensitive political topic now that we could not even talk about. So we see why it is important to do home visit. And our students don't learn it by staying at the classroom. And because they have to come back with a plan that they will design with, they will discuss with the patient, for this patient. So I will stop here to let you, to open the mic for you. Mwakoze Chane. Thank you very much.
Thank you so much, Dr. Fernie. Another round of applause to him. And right now, I would like to do the honors of having our amazing team introduce themselves, to say their names and basically what they do or who they are so that we can continue the discussion. Please stand up and join me. Okay, So since they say their names, they introduced themselves when we were doing the session, I think we will just continue. And at this time, I would like to please welcome anyone in the audience who has a question or a reflection that you would like to share with us. We have a mic in the audience. Thank you. We will try to face all sides. Yeah.
Okay, good afternoon, everyone. My name is Dr. Bolanle for short. I'm a veterinarian, and social medicine is one part that I really like. So I would just like to advise, some of the pregnant women and some of the rural people, they come in contact with animals. They rear cows, goats. Have you tried, for the tuberculosis part, have you tried to also advise them on knowledge, attitude, and perception on how they handle the milk and the meat, just to reduce the spread of TB? Thank you. Yeah, I'm very interested in One Health.
Thank you for your question. Sandra is going to help us to answer that. Do you have a mic? Yes.
Thank you so much for that question. What you've just seen here is really, I would say, the tip of the iceberg. In our community-based education, we do a lot of things, and one of them is our community promotion, where we teach, we have our students educate the community on various topics. So that's one of those, but there is quite a number of them, and sometimes when they're doing the rotations at the health centers, before even going in the services, they will spend time with the patients, trying to educate them on the topics that are usually identified with the health centers that we partner with. Yeah. I hope that answers you. Yeah. Oh yes, one important piece that VC just reminded me is also the community service we do, known as Umuganda. This is a place where usually here in Rwanda you get so many people all together. So it's a place where we use it as a platform to share information around that. And then there is something called Akagoroba Kababyeyi, so which is the evening of mothers, maybe if I roughly translate that. It's also another place where during the community-based training, our students use that opportunity to raise awareness on some of the pressing health issues. Thank you.
Thank you so much, Sandra. Do we have more interventions from the audience? I see that we have people on this side. Who has them? Oh, please go ahead. Yes.
Thank you. Good morning, everyone. I'm by names of Nina Monsonia from East African Christian College, level 2 midwifery student. It's a suggestion, and ask you what you think. After realizing that the community health worker was advising the couple to have someone to accompany the mother to the hospital, and also to have someone to stay home with the kids who are left at home. So I realized that it's almost impossible nowadays because many people are always busy in their daily activities. Even sometimes you can't find even in your family because it's not because they don't want to support, it's because of their schedule. They wish they can support, but they can't find the time to support the mother. So this captured my thought about the research that I have done about doula services. These are the services where a doula has to provide a continuous support throughout the pregnancy, labor, and postpartum of the mother, like informational support, physical and emotional support. And the research has shown that the mother who are having this doula, their rate of C-section are decreased, their prolonged labor are not that much, and they also feel like they experience their experience with birth is better than those who are not having that doula. So I recently also worked on research about volunteering of us students who are in medical field, and I would like to ask any student or every student here to realize this problem and take first step and volunteer. Like, what do you think if anyone of here or a student, every student has only one mother to take care about or support her? It can be even online. Like you can tell her like you are free to ask me any challenge that you are meeting, or according to our schedule that we are busy, but a mother having that someone who is closer to her, it makes her feel better. Because like she will even feel like this is a medical professional. She will be feeling better than those trained doulas who are just having training. We can make a difference in our maternal production in Rwanda, because like the doula, I realized that it's the ingredients that is needed to improve our maternal outcomes in Rwanda. Thank you.
Thank you so much, Sonia. That was very well said. And thank you for highlighting the aspect of accompaniment, which is something that we believe in and we want our students to also embody with their patients throughout their journeys. So it really feels good to hear that we have people who are within this movement and really understand the importance of these values. Yes, I think did she have a question? Great, yes.
Yeah, thank you very much. The team that have demonstrated to us again the importance of social medicine. My concern and question regards the sustenance of the motivation of the community health workers. I would like to know your practical experience in advocating to the local leaders and the government regarding remuneration and sustaining the community health workers. Thank you.
Thank you very much. Does anyone on the team want to take this on? Dennis wants to. Please give him a mic.
Yeah, thank you very much for the great question. For us, our community system in Rwanda, it's based on trust in the community, because our community health workers are elected, not selected. So they are trusted by the community member. And also based on Rwanda context, back to 30 years back, genocide against the Tutsi, we have been having a problem of healthcare workers that's come as a solution. For now, as time flies, the country is thinking how to sustain to do a sustainability of the program from non-paid community health workers to paid community health workers. And this is on high-level leadership. And I remember very well in the last election, even His Excellency, the President of Rwanda, Paul Kagame, ensured this time he will be the change in paying community health workers. It's considered, and given the resource constraints of the country, we still have non-paid community health workers, but not really non-paid, because our community health workers, it's not a regular payment, but they have performance-based financing, which they are paid in another way. And also, beside monetary incentives, they have non-monetary incentives, like the trust in the community and the materials they receive, even the bicycle in a hard-to-reach area. Those are the kind of motivation, but we are looking ahead about the sustainable and the regular payment. And also for the university to sustain this program, it depends again on leadership. Because as you may see, we are here with the VC, and at University of Global Health Equity, this is the program, this is the flagship of the university. Everyone is involved in social medicine in our running. We make sure we send a group of less than 60 students to the site, so it's faculty demanding, it's as well resource demanding. But for us at University of Global Health Equity, this is a must, this is a condition. And to take a CB, it's not elective, it's a must, it's the course embedded in the medical curriculum. So that at UGH, we take a priority of community-based education to make sure our students are exposed at early stage to social medicine. Thank you.
Yes, thank you, Dennis. And one piece that I would like to add, well, like you rightly said, these people do a lot of work, and it's work that in fact, if it was possible, they should be paid for that because it's a lot of work. I'm not sure if we did mention that they are part of the cooperatives. The community health workers have the cooperatives, and that community engagement is central to us. So one of the target population for us as a university is also the community health workers, to really work with them to see some of the projects that they are already doing and find ways in which we can do some of the in-kind contribution, so that they also really feel that, you know, they are part of, as the university grows, as we continue to train future doctors, but they are part of it, but we are also doing something sustainable that can help them. But again, it's a journey. We continue to learn as we implement this together with them. Thank you.
More questions? Yes.
Thank you. My name is Agathe Witonze. I am a community health nurse, and I come from URA and CMSH, but from Ghana campus. But presently, I'm a student at UJ I'm doing health professional education. So I just want to emphasize on the fact that there is a student who is saying that she learns now from this scenario. By the way, I really enjoyed the scenario. It was very good. And so what I wanted to say is I just want to emphasize on the fact that interprofessional should be also do at UJ. So they can go with some students from medical and nurses, because for nurses, actually, that question should not come here when she said that she now learned that when she go to do some education to some patient, she has to know what is giving. Actually, I usually teach my student that when you go in the community and want to do the health education, even nutrition, you first want to know what are they affording. And now from there you can add something, but it is very simple, just to make them eat all that they need. So it is very, very important to do that. And I just want to emphasize on that, the last comment, the community health workers, they are really doing very well. So for the nursing, my students, we go in the community and we work with the community in partnership with the community health workers. When you go to those interventions, you do need assessment with them and you involve them, and they feel really very comfortable when they are working with them. And they are so helpful and so engageable. So thank you so much.
Thank you very much for great insights you just shared. And I would like to also mention that one of the programs that we work with at UGHE, or the department that we work with, is the Center for Leadership in Global Health Delivery. So they have professionals from different countries, and when they come, we usually go with them on such visits. But I really like the comment that you made, and this should be made even more large scale, as you were saying, because this is important learning for all medical practitioners. Please, Dr. Akiki.
Thank you so much. I just wanted to add that indeed, as my colleagues have said, what you saw was just a window or maybe even a ventilator into what we are doing. And that medical students do not only learn from the community health worker, they learn from the patient. Jacqueline and her husband, Jean-Baptiste, are patients. And who best to learn from rather than the patient? You might say we do this at the hospital even, but to find them in their situation, in their home, and for them, remember he introduced himself as the chief. We want to find the patient in his position of power. So we learn from the patient. It is the grounding of why we are all here. It's the patients. And I'm so glad that at last we have the patient who in this congregation, when we are discussing patients, and they are the people to learn from. So we learn from them. We learn from their first person of contact, the community health worker. We learn from the nurse, because our students are coming from the health centers in the district, at the district level. I know that in the discussion, somebody mentioned that our students sometimes are trained in referral hospitals, never at the district or the health centers. So ours go through the system. They walk the work of the patient. So I'm so glad that we have the opportunity to disrupt maybe what us, the older generation, how we learned, and to actually learn from the people who are concerned and also to be taught by the very people. I'm so happy today that our patient, our community health worker are in the room here and they can teach us. We also bring them to the university. This is not a demonstration just. We actually do this. So we are glad to do that. And actually, if you give me the permission, I'd like to ask one of the people who've walked this walk with us to just give a comment, and that would be Dr. Fred.
Wow. Well, I hope all of you are as blown away by this presentation as I was, because this is about as dramatic as it can get. I mean, you guys are talking the talk, you're walking the walk, and you showed it to us. So I can't thank you all enough. It was incredibly exemplary. So I'm a physician from California, but I've been following the development of this program from the get-go. And one of the things that I think we are learning in our medical education and on the other side of the pond is how well you guys have done at integrating community-based education throughout the continuum of the medical educational time, and how incredibly important that is. And that is something that we're challenged by as all of our Harvard team here, and think, how do we continue to impress on our students throughout the course of their education the importance of the value of being connected to the patient in a contextual way where they are. And you at UGHE have done an exemplary job of that, and you're continuing to build on that. Grace, Sandra, all of you. So Dennis, thank you very much for this wonderful presentation. It was extraordinary.
Thank you so much, Dr. Fred. I see someone standing. This will be the last intervention of the session because of time, unfortunately.
All right, I promise I'll be real quick.
Continue outside.
Dr. Gakwaya from Brown University. This was amazing. So my question is about cultural sensitivities. It's kind of a minor compared to the impact of social medicine. Thinking of a family being in the middle of a village in Butaro, and you have a group of 20 or whatever, 6 medical students with their teachers, with their muzungu, show up at my house. Is this gonna be announcing to the whole community that I'm pregnant or that I have HIV? So my question is, have you ever encountered any social or communal resistance to what you do? And if so, have you had what kind of outreach have you done? Thank you.
Thank you very much. I think my team all can speak about this. Perhaps Jeanne? Wifuza kugira icyo bivugaho? Eka.
Okay. Nabaza ikibazo mu Kinyarwanda. Ni ikibazo nabazaga, ni ukuvuga ibyo muri gukora bifite akamaro gakomeye ku baturage, ariko mu muco wacu genda umuturage ndi iwanjye mu rugo, hakaza abantu bangana gutya iwanjye, ndetse hakaba harimo n'umuzungu rimwe na rimwe. Ese bituma abaturage batangira kwibaza, ese yatwitse cyangwa ararwaye cyangwa afite ikibazo batari bazi, bigatuma byateza ikibazo. N'ibyo bibazo mwarabigize, ni iki mwakoze kugira ngo mubashe kumvisha abaturage ko nta kibazo kirimo ko umuntu yasurwa n'abantu bangana gutyo? Murakoze.
Nta kibazo bagomba kugira, kuko baba babizi, niba bari kumwe n'umujyanama w'ubuzima bari kugenzwa n'ibibazo by'ubuzima. Abo ni abaturage. Ku ruhare rw'umurwayi, amavuriro yabaga kure, noneho uyu munsi by'agaciro, umujyanama w'ubuzima amusanze mu rugo, agiye kumuganiza ku buzima bwe uko bumeze, amuzaniye n'abandi bashyitsi nk'aba barimu babo baba bazi iby'ubuzima, ubuzima neza, agiye kumuzana n'abandi bashyitsi nabo bari kwiga. Rero ni iby'agaciro iyo afite n'ikibazo akakivuga, aba yumva ko ikibazo cye kigomba gukemuka. Ntabwo iyo mbogamizi yo kuvuga ngo haje abantu benshi ntabwo twari twahura nayo.
Jeanne is explaining that because of the trust that they have built with the community members, when they come with people, or when Jeanne comes with people, they trust that these people are coming so that they can find solutions together for their health. So we have not yet encountered such a challenge, but Benit wants to say something about this as a medical student. I think we can give her time. Benit.
Thank you very much, Doctor. That was indeed a very nice question about culture sensitivity. We also like to highlight that it's not always that we go because they planned visits for us. Sometimes we have encountered a patient at the hospital and we see they really need like a visit at our home. An example is a man, they always came to pick up like medications refill that was tramadol, like a pain medication. But then we're like, how is it going? But they say something that they're actually not doing well. So we went there to actually get to understand, this is a person in a palliation, where are they doing with the medications? When we arrive, that's when we actually got to learn, tramadol is not helping. The patient is bedridden. The patient is now needing more pain control than what we're giving. So we went there. This patient does not have any problem with, why are there 6 students right now? Because we have been following up this patient at the health center, at the hospital, and before we go there, they are alerted, you're going to receive 6 people. Are you comfortable with us being 6? And this is a conversation that is safe with you. Do you want us to keep being 6 here? Would you like some of us 4 to go away? Or do you want me personally, who has followed up, to be the only one? And you get to explain every member of the team and why every member has joined the discussion. So we're with a mental health specialist, with an NCD nurse, with a community health worker, and with my faculty. I'm the student who has been following you up, and I'm with my colleagues who we have been in the same group. If you would like any one of us not to be here, please let us know, and this person will leave immediately. So we get to get the consent every time we go to the patient's home. Thank you.
Yeah, this is I would say the $1 million questions that we are always facing, either when we bring Muzungu or when we have local students. But the most important things that I want to reinforce, the first step is to build trust. We, as an organization, we are community-based, and we focus on building trust first with the community health workers and with the community members. And once this trust is well cemented, everything become possible. I've seen some struggle, some organization with a lot of struggle, but until now, at PIH level, at UGH level, we did not register any stigmatization or tension from our patients. But taking the time to build trust, it's an important step in this type of work. Thank you.
Thank you so much, Dr. Ferney. Thank you, everyone. Arnold wanted to say something as we close this session. We know that we have gone past time, but this will be the last message.
So thank you. I think as students, we thought about DCBT and wanted to highlight some, probably 2 or 3 clear examples of how this course is very important as a medical student. I think the first one was, we had the visiting faculty once told us that never be angry at the patient. And I think the best example we ever had was a patient had in the health center, we're in the CBT, and had this old man who was not following up on his medication with hypertension, and he was what we usually call a difficult patient. And we decided to go and visit him at his home. And I think the car could only take us by 15 minutes, and that took probably 30 to 35 minutes walking to get to the home. And once you reach there, and I think that day it was raining, once you reach there, you realize that this old man has to walk probably 2 hours and a half to reach the health center for these medications. Even us as doctors, I think even we would go there probably once in 3 months. So I think that's one clear practical example of once you go there, once you walk, you clearly understand how difficult it is, even though the person knows that they are sick. And the second idea we had was, when we were doing the CBT, I think we had 2 days to go to the delivery room in the health center. and you had to assist even some of those deliveries. And I promise you, almost all the medical knowledge that you know goes out the window because they don't have anything. They do not have a CTG, they do not have any way of monitoring. Everything is almost like by physical exam. They know, they understand, they have to listen to the fetal heart rate to refer that patient, that mother. So I think that like triggers an interest in you. Once you're in the district hospital and the nurse they call, they say you have this mother is having this and that. You clearly understand. You have like that feeling of what is actually going on. You don't say, please give IV fluids for 2 more hours and then refer. You clearly understand what's going on. So I feel like there are many practical examples that you can give, but I feel like this is a very important course that once you have it, it clearly leaves you like a different person than you were before. So thank you.
So, ladies and gentlemen, thank you very much for sharing this journey with us. This is actually the second time I visited Jacqueline and Jean-Baptiste in their home. The first time was in their home with Jean in the first antenatal visit, and this was the second visit. So thank you for making the distance to the home slightly shorter for me this morning. I want to leave you with one word, and that one word is posture. You see, quite often when we visit people in their homes, we do actually sit on the floor with patients. Sometimes I think our curriculum is about dusty shoes and dirty fingernails. You know, but our posture tells the entire story of our belief in healthcare and our belief in the patients that we serve. Because as we approach the patients that we serve and they squeeze our hands and we earth their pain as lightning conductors as they go through the worst times of their life, or we join them in the most profoundly joyful times in their lives, we adopt the posture that's appropriate to that. And you've seen our students, and some of our recent graduates in medicine are sitting not so far away from me here. They stand proudly, and this is the posture that we now adopt as we stand proudly and say we stand with the people that we serve the most, because we have tried our hardest to understand, and we continue to walk the journey with the people that we serve. So, ladies and gentlemen, posture. Thank you very much indeed. The next posture you will adopt will be eating lunch or going to your prayers, but thank you very much.
Thank you so much. They asked me to remind those who are observing the fast that they will find vouchers at the reception area, at the registration area. Thank you so much for your time and attention.